Hello, I'm Dr. Simon Johnson and I work closely with TSC patients with LAM. And now I would like to share my experiences with you. First of all, for any patient with a long-standing lung disease, pulmonologists recommend vaccinations against influenza and pneumococcus. Usually, for patients with a history of difficult respiratory infections, I'll recommend prompt assessment when patients are symptomatic. In my practice, we typically have a lower threshold for treating respiratory infections in women with LAM with antibiotics than we do in patients without respiratory disease. For breathlessness, pulmonologists recommend pulmonary rehabilitation, which is an exercise program initially developed for patients with chronic obstructive pulmonary disease or COPD. From what I've observed in my practice, patients with breathlessness during physical activity generally do a little less exercise because they're breathless, and then they lose muscle function. They can put on a bit of weight, and this makes them more breathless when they try and exercise. This then becomes a vicious circle, and their exercise performance goes down independent of their lungs getting worse. So pulmonologists usually recommend that patients undergo a pulmonary rehabilitation program in conjunction with keeping more active by doing an appropriate amount of exercise within their capabilities. In my professional opinion, it's all right for LAM patients to get a little out of breath, providing they don't overdo it. And so pulmonologists usually recommend patients keep as active as they can within their own limits and maintain a normal weight. Obviously, we suggest that they refrain from smoking if that's an issue. It always bothers me that new LAM patients, even those with mild, moderate or stable disease, may have been told that the outcome is uniformly bad. No one knows much about it, and there's no treatment. They're often very upset by all of these things. So it is very important that patients become involved in their own care and understand what their prognosis is. The best way to find that out is to understand the progress of their disease and put it in the context of their age, their other medical problems and likely treatments, rather than just reading that LAM is a bad disease on the internet. A pulmonologist can explain all of this information better when they are one-on-one with the patient than if the patient reads a few stories on the internet. Patients need to know the extent of their pulmonary involvement, not exactly how many cysts, but how impaired their lung function is. What I feel is important is an estimate of how quickly things are changing. And so when patients have follow-up lung function tests, they should be asking their pulmonologist, is my disease stable? Is my lung function declining? And is that faster than average? The patient should also have a plan about what to do if they develop symptoms of pneumothorax, also known as a collapsed lung. They should know what to do if they develop symptoms of a respiratory infection. They need to understand the general measures that everybody should take about avoiding estrogen, about vaccinations and so on. If patients have pneumothorax or they have chylous pleural effusions, they should be informed about what action would be best to prevent this from recurring, as there is a lot of morbidity around pneumothorax and treatment. Pulmonologists suggest that these patients have fairly early intervention to prevent pneumothorax, such as a surgical procedure.